Many radiation therapists have asked us how to get even more stability out of their thermoplastic mask and head supports. We're answering. We'll show you how to get the most out of your setup from the very first sim. Whenever I have the patients come in for a brain or a head and neck sim, I always start them at the exact same spot, and then I check the gap underneath their neck here. When you're trying to choose the correct headrest, you really kind of pay attention to a couple different spots here. So when we ask the patient to bring her chin up like this, kind of notice what happens to this headrest here.
There's a little neck gap right here.
You get a neck gap right there. So we're gonna try a little bit of trial and error and see which one fits her better. What I like to start every patient off with is the 9-degree wedge and the 4 headrest.
Okay.
It's just kind of, I like to start every patient in the same starting position. That way, like, you'd be surprised at how many patients will just fall into that starting position and you don't have to change anything in the treatment room. You're like, what's the next patient at?
Right.
Same setup, let's just rock and roll. So let's see if this works. This is where I start almost all of my head and neck patients. I would say probably all of them. Come on down. And that way when we put the 9-degree wedge, it gives her a kind of a natural chin tilt up.
Yeah, and then there's no more neck gap right
No more gap
either.
there. We got the 2mm shim in there just in case it shrinks a little bit more than we're expecting, so it would be comfortable for the patient.
Perfect.
So if you can't find a headrest, like a patient, none of these headrests fits a certain patient, you can make a fully customizable headrest with a mold care. So we just take this headrest out, and I like to make it right on the wedge itself so it can kind of index itself down into these holes here. So kind of give it a good push down here so it can index itself in, and then go ahead and lean back for us. Now we're going to support her head and neck with a fully customizable headrest. So just working with the mold care until it starts to set up. It could take 5 or 10 minutes or so for it to set up, but it'll be fully indexed, fully customizable to the patient. It's, you know, for those patients that have a different shaped neck, maybe a different shaped head, that are just not getting all the gaps out when you have every headrest you try.